Hi, everyone. This is our presentation of the Native American Ojibwe people and our ethnographic research experience. So who are the Ojibwe? They are a tribe of Native Americans who are indigenous to the Great Lakes area. They traditionally live in groups called bands on reservations, but many also live in our great city of Chicago. The Ojibwe are also known as the Chippewa tribe. In regards to their perspectives on healthcare, the Ojibwe believe in spiritual and herbal healing practices. They put great emphasis on their traditional medicine wheel and use talking circles to educate and discuss topics. The Ojibwe have a collectivist mindset in regards to their sense of self in the group, and they have a high context culture. In the image here, you can see where the Ojibwe predominantly live in the Great Lakes region and the path of their migration.
Our research took us to the American Indian Center of Chicago, where we talked to Fawn Pochel. Oh, sorry about that. We talked to Fawn Pochel, the education coordinator there. Fawn told us about the services offered by the center and how it's a place for people of local Native American heritage to find community and practice cultural traditions. She then referred us to the American Indian Health Services down the street. At the Health Services office, we spoke with Dr. McGee, a family nurse practitioner and former occupational therapist. She grew up on the Turtle Mountain Band of Ojibwe Reserve in North Dakota. She told us about Ojibwe culture and Native Americans' experience in our healthcare system. We had also planned on visiting a museum, but we couldn't make it, so we did some research and found some great sources created by Native Americans, the government, and museums. Finally, we watched a short PBS video of an Ojibwe man named Eddie Benton Benet describing Ojibwe history and the tradition of oral storytelling. Here's our favorite quote from that PBS video. "If you're healthy in spirit, healthy in body, you are wealthy." This illustrates the importance of spiritual health to the Ojibwe people.
So here's a little background on the history of the Ojibwe and their experiences with American culture. The Ojibwe were forced to leave their bands when it was taken by Westerners. These Euro-American people also imposed their Christian values on the Ojibwe and forced them to attend Christian schools. Because of this, the Ojibwe felt like their culture was being dismantled by the Westerners. These feelings of discontent against Westerners continue to this day. As many Ojibwe feel this disconnect from their cultural roots, especially after leaving the reservation to come live in Chicago, places like the American Indian Centers were created to preserve and celebrate these traditions and heritage. The Ojibwe have a very strong connection with the natural world. They rely on nature for food by gathering, hunting, fishing, and gardening. They traditionally create leather moccasins and wigwam houses. The Ojibwe also tell important stories and their cultural traditions about nature and the animal world. They cherish their animals, and the 7 original clans actually have animal names. In regards to medicine, the Ojibwe take pride in their sacred herbal healing techniques. They use sage, cedar, sweetgrass, and tobacco, among other things, to make remedies and treat illnesses.
Here are a couple of different visuals of the Ojibwe medicine wheel. It is split up into sections by the 4 cardinal directions, and each section represents an aspect of health: physical, emotional, behavioral, and spiritual. In the traditional Ojibwe stone medicine wheel, each stone represents animals whose qualities are important to the Ojibwe people. The wheel is used in healing ceremonies in which everything is done in a clockwise or sunwise direction, so as to connect participants with the natural forces. According to Eddie Benton Benet from the PBS video, the life expectancy of Native Americans is the lowest among all ethnic groups in the United States. In fact, they're twice as likely to develop diabetes than are white Americans. Many diabetic Native Americans also develop renal disease because they have a difficult time managing their diabetes.
Another disparity the Ojibwe people face is limited access to healthcare. There are limited transportation options, and traveling into the city from outside reservations can be both timely and costly. The AIHS clinic that Dr. McGee works at is frequently understaffed as well. This leads to longer wait times for the patients, decreased quality of care, and it perpetuates the issues around health literacy and the patient's understanding of their care and treatment. These patients may not understand how necessary it is for them to go to their appointments, and they may also need extra time with the doctor to get a better understanding of their diagnosis and how to best manage their health. This extra time with patients also should be used to build rapport with an Ojibwe patient, as they value human connection and look for understanding in their health providers. In our research, we learned that Ojibwe people and the greater Native American population lack health literacy. They are raised to speak their native tongue, Anishinaabe, and may not have a great comprehension of the English language. These patients may also be used to receiving their medical care from people on the reservation, such as herbal healers or a shaman spiritual healer. This, along with their limited understanding of Western medicine, can create a rift in their openness to be seen by a Western healthcare professional. The Ojibwe patient may be hesitant to ask questions to the provider, and American healthcare providers are typically not trained to check in for comprehension with patients to get a sense of their understanding of healthcare. These things can lead to a disconnect in the patient-provider relationship when there are many methods you can use to connect better with an Ojibwe patient population. One of the most profound things we took away from our interview with Dr. McGee were the benefits from running a health literacy program involving talking circles. Because the Ojibwe people thrive on building human connections and storytelling, these talking circles seem to be a great opportunity for Dr. McGee to teach her patients about diabetes care and understanding. After her intervention, Dr. McGee found that patients in her talking circle study had an overall 90% health literacy rate, whereas they only had 30% prior to the intervention. We feel like this gave a great example of how important it is to understand the cultural values of a patient population to most effectively provide care and support good health literacy rates.
As demonstrated by Dr. McGee's success in treating her Native American patients, it's essential that healthcare workers, like occupational therapists, understand the relationship that the Ojibwe and other Native American people have with healthcare. When treating people from this culture, we must take into account the fact that their traditional healthcare involves a lot of talking, herbs, and spiritual healing. We should also keep their health disparities in mind. If you work in a setting that treats a lot of Native American people, like an American Indian Health System office, you can learn to apply for vouchers to make coming to the doctor virtually free for patients coming from out of town. Some other ways that we might adjust our practice for this culture is to lead talking circles in group therapy and spend time to get to know our clients before addressing their medical issues. This will help them feel more comfortable in our healthcare culture. You should also check for understanding frequently and before ending the appointment to make sure that the patient understands and to allow them time to feel more comfortable asking questions. All right, thank you guys for watching. We miss you all.
Thank you.